In the mid-1800s, on a plantation in Alabama, a teenage enslaved girl named Anarcha endured a labor that did not end cleanly. She was approximately 17. The birth was long, obstructed, brutal. The child did not survive. She did, but survival came altered. Anarcha was left with a vesicovaginal fistula, a catastrophic childbirth injury that tears a hole between the bladder and the vagina, causing constant leakage of urine. In the 19th century, it meant odor, isolation, humiliation, a living wound that never closed. Women with fistulas were often cast aside, deemed ruined. She was property, and property could be sent to a doctor. That doctor was Dr. J. Marion Sims. He would later be called the father of modern gynecology. His name would be etched into textbooks. A surgical instrument, the Sims speculum, would carry his legacy forward into examination rooms around the world. But before the legacy, there were the bodies. Between 1845 and 1849, Sims conducted experimental surgeries on enslaved black women, primarily in Montgomery, Alabama. Among them were Anarcha, Lucy, and Betsy. Their names preserved in medical records almost as afterthoughts, yet central to the story. Sims was attempting to repair fistulas, a condition that had confounded physicians. He operated repeatedly. On Anarcha alone, historical records indicate he performed approximately 30 surgeries before achieving what he considered success. There was no anesthesia. Ether anesthesia was introduced publicly in 1846 and began spreading into practice soon after. Sims would later use anesthesia when operating on white women. But during his early experimental procedures on enslaved women, he did not. He claimed fistula repair was not painful enough to require it, a statement that sits uneasily against the documented agony of invasive pelvic surgery. Lucy nearly died from infection after one procedure. She endured extreme pain and fever. Sims described her suffering clinically in his notes. He did not stop. The women were held in position by assistants, sometimes other enslaved women, while Sims operated. Metal instruments, sutures, repeated incisions, trial and error on living flesh. In medical journals, this became innovation. In lived experience, it was captivity layered onto captivity. These women could not refuse. Enslaved people were legally property in the American South. Their owners permitted the procedures. The distinction matters. Permission was granted by slaveholders, not by the women themselves. Personhood was not recognized, their pain was not prioritized. Their survival was conditional. Sims eventually developed a surgical technique using silver sutures that successfully closed fistulas. The breakthrough elevated his reputation. He moved to New York. He founded the first women's hospital in the United States. Statues were erected in his honor. Meanwhile, the names of the women who made that success possible remained largely in the margins. The power imbalance was absolute. A white male physician in a slaveholding society experimenting on enslaved black women whose bodies were not legally their own. The language of medicine framed it as progress. The social order framed it as normal. But beneath the surgical reports is another truth: repeated operations without consent, without anesthesia, without agency. This is where the horror lives. Not in gore, not in spectacle, but in the quiet normalization of suffering. Breakthroughs were built on bodies that could not say no. Today, obstetricians still use variations of the Sims speculum. Fistula repair remains a critical surgery worldwide. Medical students learn the history of gynecology, though often without dwelling on who absorbed the earliest pain. In recent years, statues of Sims have been removed. Historical re-evaluation has intensified. Scholars and physicians debate how to hold both truths at once: that he advanced surgical technique and that he did so within and benefiting from a system of racial slavery. Anarcha survived the surgeries. Historical records show she eventually returned to plantation life. There is no record of her consent, no record of her voice, only outcomes. Medical history often celebrates the moment a problem is solved, but rarely does it sit long enough with the question, solved for whom? Because when personhood is stripped away, when pain is dismissed as tolerable, when experimentation hides inside hierarchy, the wounds do not vanish with the scar. Some injuries close, others echo, and the echo is still with us.